I rise in strong support.
Please proceed.
Mr. Speaker, this is possibly the most important bill of this session. It has to do with the coronavirus and our approach by putting finances in place. And it can't be overstated how potentially dangerous this is, but how potentially helpful this bill is going to be. First, some of the ball scores. Mr. Speaker, as of, I believe, today, Greenwich Mean Time, there are 90,433 coronavirus cases worldwide, 3,119 deaths, 48,110 recovery. Mr. Speaker, the good news is that as Wuhan has been the epicenter, the death rate has not exceeded about 3%. That is good news. Basic health procedures have prevented that. But I want to read a statement from the WHO China that suggests things may be still a little bit pending in their understanding. This is from Bruce Alyard, who's the head of the health organization, WHO in China, or one of the joint leaders there. Mr. Alyard says, I think the key learning from China is speed. It's all about the speed. The faster you can find the cases, isolate the cases, and track their close contacts, the more successful you're going to be. Mr. Speaker, that suggests this is a behavioral phenomenon, which with the funds that are in this bill, hopefully that will modify some of the behavior of individuals. Carrying on with the message from Mr. Alward, he says, people keep saying the cases are the tip of the iceberg, but we couldn't find that. Mr. Speaker, that's pretty good news. It's not the tip of the iceberg. We found that a lot of people who are cases, a lot of the close contacts, but it's not a lot of symptomatic circulation, which is good news because some people didn't know that they had actually any contact with the virus. China got patients in treatment early and have highly sophisticated healthcare treatment procedures. From some of the people I've talked to, Mr. Speaker, they've said this is a little bit gratuitous on the basis of what we learned from China, how soon we learned from China, and some of that may have been late. They have a survival rate with the mortality rate of under 1%. I think that's a bit of an exaggeration. But it's where, outside of the provinces, I would not extrapolate to the rest of the world. Mr. Speaker, that is obviously good news. So panic and hysteria are not appropriate. This is a disease that is in the causes and the which is passed by the close contacts. It's not a hidden enemy lurking behind bushes, Mr. Speaker. And if you look at the numbers of the flu and the flu deaths for this season already are in the thousands. So when we in the U.S. have about 100 cases and 6 deaths, it's very, very minuscule. In fact, it's maybe without much consideration. But the potential for it to spread is very, very serious. As we know, some of the flights that were coming here from China have been discontinued. The flights to Korea by most airlines, including our Hawaiian Airlines, kicked off a protective measure. So, Mr. Speaker, the bottom line is I applaud the Speaker, I applaud the Chair of Finance for quickly getting this $10.5 million, which, Mr. Speaker, if there's any bill that should be left blank or let's say open so we can meet the cause of what we need to come to, we need a lot of things to be done, and maybe the $10.1 million is not enough. So I hope that as things progress, the Finance Chair and the Speaker will adjust it accordingly. Mr. Speaker, most international airports are screening individuals, New York, Chicago, San Francisco, Atlanta. But Mr. Speaker, to my understanding, as I speak now, there is no one in the international airport screening all the overseas, whether they're Americans or overseas citizens, in the Hawaii International Airport. So for the sake of prudent avoidance, Mr. Speaker, hopefully some of the money that is in this bill will go for that. And lastly, Mr. Speaker, on a personal note, I want you to know that I complained severely to the White House as to why we were even chosen as one of the 7 now 11 different areas. When 50% of our economy is dependent upon the visitor industry, I think we are taking a huge risk by what the federal government has put us to. Having said that, we have to stand up responsibly, as this bill suggests, but we also have to have prudent avoidance of things where we are not paying full attention to what's going on in these other epicenters.
Mr. Speaker, I yield my time.
Having said that, I yield back my colleagues' time. Thank you. Thank you.
Thank you, Mr. Speaker, and strong support. This bill, House Bill 1629, which is now House Draft 1, started out as just a bill to deal with last-minute issues. So we wanted to at least thank the members to give us the flexibility by inserting new language. I think this is the reason why we are in the legislative process, to deal with emergencies, and this is exactly the reason why we need vehicles moving. We just wanted to give notice to the members that we are working directly with the administration and the Senate, and Senate has also found a vehicle to replace the exact same language in a Senate bill, because at this point in time it's still early. As the minority leader recognized in what Hawaii needs to be prepared for, according to the World Health Organization, they are encouraging all nations and all states and all countries to be proactive. That was the reason why they were able to contain SARS very quickly and H1N1 virus very, very quickly, because it was the result of being proactive by various governments. And so for us, being a very heavily tourist industry, or dependent on the tourism industry, we need to be vigilant. And just to give notice to the members and the public, what you see in the bill today may not be what is passed at the end, because at this point in time we need to be very flexible. We may have to deal with other type of containment opportunities, or we have to work directly with the various counties to deal with what do they do with quarantine. So we wanted to make sure that we put ourselves in a position where we're completely flexible to deal with the COVID-19 virus. But thank you very much to the members for your flexibility and understanding.
Thank you. Any further discussion?